Okay, I think we can start. Good afternoon, everyone joining this session. My name is Jan Douwer. I'm an interdisciplinary specialist in. Oh, sorry. Okay, can everyone hear me now? Okay. Start again. So I'm Jan Douwer. I'm an internist infectious disease specialist at Erasmus Medical Center in Rotterdam, the Netherlands. And together with Juliette Severin, I will be moderating this session. So Juliette, can you please introduce yourself?
Yes, good morning, good afternoon, wherever you are. I'm very glad to have this session in the winner event in 2023. And let's start, I think, with the presentations because we have just a few minutes in this time. But just to be sure, I'm Juliette Severin. I'm a clinical microbiologist also at Erasmus MC. And so back to you, Jan. Shall we start with the presentation, Jan?
So Dan, Helen, can you help with the audio because it's going on and on again? So no, I'm not muted. There's a huge delay between what we say and what.
Yeah, Jan, we can hear you very well, so I think it's good to continue with the presentations. Or you want to? The sound is
Others
perfect
can hear
for me.
as well. Then, but I hear the audio going on and in circles. So I'm not sure if that happens with you that you hear something spoken earlier on and then repeat it again. It's very annoying. Okay, so we should be fine now. So first presentation will be by Andy Roof and Sultan. So Andy, if they can put up your presentation, then time is yours.
Thank you, Professor Ian. Thank you for the opportunity. Thank you. Um, yeah, I would like to tell the story how I involved with the antimicrobial resistance. In 2009, I started project with the antimicrobial resistance on aureus taken isolated from human and also flying fox, and also in where I I applied for scholarship to go to Netherlands, and I got scholarship from BT, and then joined the Erasmus MC. Next slide, please. Uh, the first, yeah, the first time. At that time, this is really the first time I went abroad. So it's 1,000 kilometers from home. It's quite scary, and I joined with the one of the master program in Erasmus MC. unfortunately, for the first year, I have failed. It's not really good grade, so it's not really fit with me because the things is not with my subject. So I got called from the university at the time. They asking me what you gonna do next. Would you like to try another master? And that's the time I got I contact with the master of infection immunity from Yan Nguyen, and I got called for interview. Next slide. And 2011, I joined them, and yeah, I work with the Aureus biofilm associated infection, especially to see why this biofilm really resistant to antibiotic. I work with Dr. Van Wamel, working with the biofilm. My first time project, like I show you in my first slide, it's about uh, um, paracetamol reduce the effectivity antibiotic. And yeah, I can show that during my master program that indeed if you're adding biofilm with antibiotic, you got the bacteria become more resistant against antibiotic. Okay? And it is quite a good result. And then I continue with the education for PhD also with uh, Van Wagner. Next slide, please. Yeah, in that PhD program, it's still continuation of my biofilm study and antimicrobial resistance, and I'm able to make a new model using new platform so that you can really predict when the antibiotic become resistant using microcalorie meter. So if you're adding for example, you give the bacteria with the single antibiotic, you will see when this antibiotic become resistant. You can also see what kind of antibiotic that you can add to inhibit this resistance. For example, here I'm using rifampicin to clear the biofilm, but yeah, after 10 hours, it seems like the bacteria become resistant again to rifampicin, and I can test another antibiotic, for example, levofloxacin. And the lucky things in 2019, I back to Indonesia and combine my PhD with a clinical microbiologist in training. And I try to find what kind of drug that I can get from nature that I can use to inhibit this emerging resistancy. And yeah, working with the Erasmus MC, they give me all the technology, and I can get what I want. I found one of the compound we call neobapa isoflavone, and this is really effective to reduce the emergency of the resistance, even clear the biofilm. For example, we here the left side here without my compound, and the left side and the right side is the one with adding compound, and we can see clearly that there is reduction of the biofilm. So this is one of my result in working with the combination of my PhD with clinical microbiologists in 2000. Next slide. In 2000, last year, I finished both of my PhD and also my uh, clinical microbiologist in training, and now I continue working with the biofilm and mostly focus on MDRO. And for this year, we do the molecular surveillance in this Indonesian, in this eastern region of Indonesia. We look at every puskesmas and farm. We found that at this moment, we have found 50% of the puskesmas environments have the bacteria that resistant against carbapenems. This is quite interesting because whenever you use carbapenem in puskesmas, we always think this drug only a problem in hospital. They use it in a hospital, but that's not true because even in puskesmas, the one from isolated island, you can find also this gene. So I'm still working with this until today, still working, and I think also working with Erasmus MC. I think that's all I can tell the story of my education from start of my master program until now. Thank you. I guess if you have any question, please.
Okay, Andy, thank you very much for your presentation. I think the questions we can leave to the end because then we have a Q&A session. Seems luckily the sound at my side is good. Okay, now I'm not hearing myself repeatedly. And what I forgot at the introduction, of course, to say is that this is a session on capacity building for AMR. So the session really is meant to show different personal trajectories in being trained as an infectious disease doctor, microbiology doctor, and being in the field of AMR in close collaborations between Dutch institutes and Indonesian institutes. So I think we just continue with our second speaker. I'm not sure who's going to be the second speaker. David, do you want to go?
Yes.
Yes. Okay, floor is yours then.
Thank you. First of all, I would like to thank to the winner conference committee and Dr. Jan for the opportunity to share my experience as a PhD student, considered as a route for capacity building and international research collaboration on AMR. Let me introduce myself. I'm Dewi. I'm a clinical microbiologist in the Department of Clinical Microbiology, Faculty of Medicine, Brawijaya University, Dr. Saiful Anwar Hospital in Malang, Indonesia. These are the talking points. First, about my journey from MD to PhD. The second, my PhD program as a capacity building to combat antimicrobial resistance. And the third, developing research collaboration, international research collaboration after my PhD. And the fourth, the take-home message. First, I would like to explain my position. I live in Malang. It is located between Jakarta and Bali. So it's in the East Java province, 800 kilometers from Jakarta, the capital city of Indonesia, and 400 kilometers from Bali. My journey from MD to PhD started when I was graduate as a medical doctor from Faculty of Medicine, Brawijaya University in 1996. And 1 year later, I was a general practitioner at Ngudi Waluyo Hospital in Blitar. It's about 60 kilometers from Malang. In 1998, I have been the member of staff at the Department of Clinical Microbiology, Faculty of Medicine, Brawijaya University in Malang. And 2 years later, in 2000, I have been the member of staff in the Laboratory of Clinical Microbiology, Dr. Saiful Anwar Hospital, Malang. During 2001 to 2003, I was studying my master program on medical microbiology and the Faculty of Medicine, Airlangga University, Surabaya. And then in 2007, I start with my PhD project. It's about MRSA study in Indonesia, particularly on the molecular epidemiology of MRSA in Indonesia, involving 5 centers, Malang, Surabaya, Bali, Semarang, and Padang. In 2009, I started my PhD program in Erasmus Medical Center Rotterdam, the Netherlands. And during my PhD in 2014 and 2015, I have opportunity to join with Infection Prevention and Control Committee and Antimicrobial Resistant Control Committee in Dr. Saiful Anwar Hospital in Malang. And I was graduated from PhD program in 2017. So my PhD program is considered as a route for capacity building to combat AMR because during my PhD program, I have a comprehensive and in-depth understanding of the specific aspects on AMR, particularly the epidemiology of MRSA in Indonesia, which is crucial for developing effective strategy to combat the MRSA transmission and spread in Indonesia. In addition, as a PhD student, I learned a lot how to design study, collect and analyze data, and evidence-based conclusion. AMR is a complex problem that requires interdisciplinary solution. So during my PhD project, I collaborate with Infection Prevention and Control Committee and Antimicrobial Resistance Control Committee in Dr. Saiful Anwar Malang. So it was a good collaboration. My supervisors were Professor Dr. Henry Verbrugge as my promoter, and my co-promoter were Professor Sanarto Santoso from Faculty of Medicine Brawijaya University and Dr. Juliet Severin from Erasmus Medical Center, same with Professor Henry Verbrugge. Several publications had been generated from my PhD project. First, about the epidemiology of MRSA carriers in hospitals in Java and Bali, Indonesia, and characterization of MRSA isolates from 4 tertiary care hospitals in Indonesia. Intervening with healthcare workers' hand hygiene compliance, knowledge, and perception in Dr. Saiful Anwar Hospital. Risk factors analysis for MRSA carriers among patients at admission to the surgical ward in Dr. Saiful Anwar Hospital. And the last, we developed an intervention study to reduce the transmission of MRSA. And then after my PhD, I have opportunity to develop international research collaboration with Erasmus Medical Center in 2 projects. First, impact of COVID-19 care to antimicrobial resistance in Indonesian hospitals, funded by British Society of Antimicrobial and Chemotherapy. And then the second is improving care of uncomplicated urinary tract infection associated symptoms in primary health care settings in Indonesia, funded by Otto Kranendong Fund, started in 2023. So the take-home message: a career in research can be fulfilling for those who are passionate about inquiry, discovery, and contributing to the advancement of knowledge. A PhD path can be an excellent route for capacity building in the context of antimicrobial resistance. Research collaboration plays a pivotal role in combating antimicrobial resistance by fostering innovation, accelerating scientific progress, and developing effective strategies to address this global health threat. Thank you for your attention.
Okay, David, thank you very much for your very clear presentation. So we move to Julia to give her presentation.
Yeah, thank you, Jan. Assalamualaikum warahmatullahi wabarakatuh. First of all, I want to thanks for Dr. Jan Nowen and also Dr. Juliet Severins that give me the opportunity to give about small presentation, maybe short presentation about my career and also about how we can build the path of the AMR in Faculty of Medicine Universitas Indonesia right now. Maybe it's a little bit different with other friends, and I'm starting my career right now from 1996. Next. I'm starting my career in 1996 and graduation as a medical doctor from Andalas University from Padang. Is another island from Java, is in West Sumatra. And after that, I directly going to the primary health care as a head of the Puskesmas, doing my internship for 3 years until 1999. In the Puskesmas, I learned many things about the community, health community, especially about infections and everything, and also learn about how to manage people in there. And after I'm finished my internship, 3 years internships, and I directly as a lecturer on Department of Microbiology on Andalas University Padang. On 2004, I moved to Jakarta and starting my training on clinical microbiology specialist as fellowships, and it takes about 4 years. And this is build my path about the what kind of the focus research that I should do that, because in clinical as a training on clinical microbiologist, when I'm doing my thesis for my clinical microbiologist, I already starting doing like a research collaboration with clinicians in intensive care units, and also doing research on the like hospital acquired infections and many things. And I'm graduations on the as a clinical microbiology specialist on 2008. Next. On 2008 also, I got the fellowship from Erasmus MC, doing the fellowship of consultative aspect. This is one of the point that's opened my mind, because from the things that's as a clinical microbiologist, maybe I only working on the bench. When I'm doing my fellowship in Rotterdam for the 3 months, this is the make open my eyes that clinical microbiologists not only in the bench, and but also we are can do it in the clinical, and can have a nice collaboration with clinicians and also the others multidisciplines. Next. And I'm started doing the focus research for AMR, and I got the sums of the funding, maybe local funding from Universitas Indonesia, and published some publications in 2011. I'm sorry, maybe it's not too clear. That's one of this is one of my thesis about the resistant profile similarity between oropharyngeal colonized. This is one of the this is my thesis as a clinical microbiologist. Next. In 2009, I got the helping our faculty, especially in our department, getting help from Professor Februch. Professor Februch, one of the clinical microbiologists, really help us to build the capacity building about how the clinical microbiologist rules, the good rules of the clinical microbiologist. He stays in our faculty as a 3 months and give the educations like a ward rounds, talk to the clinician, and talk to the manager or the director of hospitals, that we can exist as a in the hospital, that's as a clinical microbiologist. Also, Prof. Bruch on 2018 or 19 also built the Indonesia, one of our institute about the research is IMERI, Indonesia Medical Education and Research Institute in Faculty of Medicine, Universitas Indonesia, and Professor Februch as our scientific director of that. And he very helped us to build everything about the focus research, especially of AMR, combating of AMR in Indonesia. Next. And also my supervisor, like a Juliet Severins, until now, give the still engage the collaborations. Also, Dr. Jan Noen still engage collaboration with us, especially about the give the and helping us about the lecturer to the undergraduate, also postgraduate students, and also like we have a collaboration, nice collaboration research until now. Next. And in 2020, I got my PhD on Erasmus University, and my thesis is about the ICU acquired Carbapenem non-susceptible bacilli in Indonesia, focus on Acinetobacter baumannii, Klebsiella pneumonia, and Pseudomonas aeruginosa. But I'm not stopped until I'm not stopped in here. I'm still continue with this AMR, and until now we still and setting up about some of the research collaboration, especially international collaborations, and some of publications that's international publications that from my thesis is, I think is more than 8. Next. yes, I have a couples publications during my thesis. Next. And until now, we still working about this publication, and we still continue our research. Next. And from 2021, I appointed as a head of clinical microbiology on department on Faculty of Medicine of Universitas Indonesia, and Dr. Cipto Mangunkusumo, and also head of the clinical microbiology laboratory on Dr. Cipto Mangunkusumo Hospital. Before that, we are not exist on this hospital, but until since 2021, we can doing and running the clinical microbiology in this hospital. And also in IMERI, in Faculty of Medicines, IMERI is Indonesian Medical Education and Research Institute. I also appointed as a PI of AMR Research Challenge. Next. IMERI has a programs. Next. To combating the AMR, AMR has a research program. One of the research program is about antimicrobial resistant containment in tropical middle income countries. And one of my objective or one of my tasks is how to manage and collaborate to doing some research or some publication with antimicrobial resistance. Next. This is my main objective right now to manage the AMR research challenge in IMERI. Is I still make an open for all of the researchers from the all of Indonesia that we can collaborate it to doing the AMR research challenge here in Faculty of Medicine Universitas Indonesia. Next. This is of some of the objective, or also some of the aim for our study. That's right now. Next. We have some collaborations research. This is the roadmap that we want to achieve for the AMR research challenge. And also, next. Right now, we have some international collaborations right now, especially with Netherlands. With Sampan, also together with Dr. Juliet Severins, is a smart surveillance strategy to carbapenem-resistant Pseudomonas aeruginosa. As a PI is Dr. Anis Karuniawati, with collaborator with Erasmus MC, Delta Res Netherlands, Laval University from Canada, and also the Italy. And also we have a collaborations that's as a PI is myself. We have a collaboration with Oxford University and got funding from Wellcome Trust. Is clinical-oriented antimicrobial surveillance network phase 2 or a CORN in 3 hospitals in Indonesia. And also maybe this will be explained more about the One Health project, is coincide. Next. And also some collaboration research that's involve many researchers that will be working together in IMERI. We not only got funding from international funding, also we got some funding and grant from Indonesia or local, like from UI, from BRIN. Next. And also from the Ministry of Education and others. Next, we hope. Yes. Okay. Next. Yeah. I hope we can still build or you can still more making a best of the capacity building, especially for the combating AMR research here in Indonesia, especially when we have nice collaborations and have engaged with Netherlands. Thank you very much.
Thank you, Ria, very much for your presentation. I think many leads for perhaps also the discussion later on how to indeed combat AMR in Indonesia or also the rest of the world potentially. So then I give the floor to Dr. Anis to give a presentation and I think also your priorities for AMR in Indonesia. So Dr. Anis, floor is yours.
Noan and also the committee for this winner 2023. I appreciate, and it is an honor for me to have the opportunity to present about the AMR capacity building in Indonesia. Please, next slide. Yeah, first I want to introduce myself. I'm currently as a lecturer in the Department of Microbiology, Faculty of Medicine, Universitas Indonesia, in the same place as Dr. Yulia Rosa. And I'm also as a Vice Dean here. And I have also, I work very close with Ministry of Health because I'm appointed as the chair of the National Committee of AMR Controlling Program since 2021. This committee is actually already established since 2014, but from 2014 until 2020, it was chaired by Dr. Hari Paraton from Sutomo Hospital, Surabaya. And then since 2021, it was changed with me as the chair. And I'm also the chair of the Indonesian Society for Clinical Microbiology, or we call it as PAMKI. Next slide, please. So I talk here more as a chair of the committee, AMR Control Committee from Ministry of Health. Indonesia has already the second round of a national action plan. Before the previous period, we had already the NAP on AMR from 2017 until 19, and this is the current one, which is already made in 2020 and will be finished in 2024. This national action plan is a result actually from the very hard discussion among some ministry. So from the Ministry of Health, Ministry of Agriculture, Fishery, and also from the Ministry of Education, and also other partner, which is, for example, Fleming Fund, USAID, and so on. And next, please. In this, so you can access this national action plan through the website that I've wrote in the previous slide. So the strategic objectives of the National Action Plan on AMR in Indonesia is almost the same as stated in the Global Action Plan made by WHO. So from the first one is about the raising awareness and understanding of AMR. The second is the improving scientific knowledge and evidence through surveillance and research. And then number three is reducing the incidence of infection prevention. And then, reducing the infection through sanitation, hygiene, and also prevention and control infection. The fourth is about the optimizing of the use of antimicrobial. The fifth is about the increasing spending on medical treatment governments. And the last one, the number 6, is very specific for Indonesia. So because the government really want to implement the One Health approach in combating AMR, then we have a very specific strategic objective. Number 6 is developing integrated governance and coordination to control antimicrobial resistance. So from this strategic objective, the last one, we already have also like a technical working group, which consists of many stakeholders and also ministry. It is just published in the beginning of this year, and we usually we meet each other to discuss about the achievement of the National Action Plan. Next. Last held the presidency of G20 in Bali, and at that time AMR is not considered as the main issue, and that's why we put it so this is the decision also from the Ministry of Health that AMR was in the side event. So there are 3 side events at the time about One Health, tuberculosis, and AMR. And in this event, we discuss many things about, but focus on surveillance. So how to do proper surveillance, specifically in the low middle income country, because we know that the facility and also the capacity in low middle income countries is still very low. And also we discuss about the IT system, how the reporting system from the national level, regional level, and also international level. So this is the last, the offline meeting at that time, because each side event have 3 times to meet, and the first and second was virtually, but the third one was held in person in Bali, and led by our Vice Minister of Health. And so I'm here in the right side of in the picture as a co-chair. From this, next slide, please. From this meeting, there are a call to action, so which is already agreed by all the 20 country members. And it is also not easy. So it's surprising me actually, because even though maybe 1 or 2 months after the last meeting at that time, we still discuss about the right or the decision about the call to action. And this is the last one, the final one. The important thing in this call to action is that we have to implement our own national action plan across all sectors. This is very important because it is very hard for each country here in the low middle income country and also in Indonesia to have the budget to implement the national action plan. And also that we need to use the One Health approach to combat the AMR, strengthening the surveillance, and also to enhance the coverage and quality of diagnosis of infections and resistant infection. And then, this is also very, very important, I think. And to strengthen the surveillance system and also to enhance the quality of diagnosis, of course, it is very important to do the capacity building. Next slide, please. Yeah, so we don't have until now the monitoring and evaluation or the MONEF system in Indonesian for AMR is not done properly, I think. Even though we have already the regulation that mentioned that all hospitals should have the AMR team to control the use of antimicrobial in their own hospital, and in the other also that we have already published a guideline for antimicrobial stewardship program, and it was published in 2019. So the only monitoring evaluation was done by WHO in 2023, so early of this year, and this is only in 4 districts, 2 districts in Central Java and 2 districts in East Java. It is near Dr. Dewi, so in Malang and also Blitar. And you can see here that the implementation is very still very low, the implementation of AMR program. So of course, don't have any guideline for antimicrobial stewardship in the Puskesmas. Next slide, please. So Indonesia is very wide. So talking about hospital, we have 2,000, so almost 3,000. So that's why it is very, very hard to even only to disseminate the guideline itself. It is not easy. And also for Puskesmas, until now, or the primary healthcare facility, until now we don't have the guideline, but we can actually refer to the guideline of aware made by WHO or Access Watch and Reserve Antibiotic. Yeah, but it is also very hard to monitor and to evaluate because the number of Puskesmas or primary healthcare facility in Indonesia is more than 10,000. Next slide, please. Yeah, so that's why, of course, we need collaboration. For public hospital, maybe it is the responsibility of the government directly, yeah, from it can be from the Ministry of Health or from the responsible from the local government, because some, well, mostly actually most of hospital belongs to the local government. So all the budget and they should get the approval of the their plan from the local government. But because there are also so many private hospitals, so we have to think about them as well. So that's why many collaboration is actually also offered to Indonesia, and one of them is from the Netherlands, which just we have met each other, I think last month, yeah, with also Dr. Juliet Severin. So this is the team from the Netherlands, consists of Mr. Bart Loman from the Dutch MOH, Rosa Peran also from the Dutch MOH, Heike Smith from RIVM, Caroline Russen, and then Dr. Juliet Severin, and also Dr. Jeroen Schotten from Radboud University Medical Center. So we talk or we discuss much about how to do the antimicrobial training on antimicrobial stewardship, not only in hospital, but also in the primary healthcare facility. Next, please. So the last 2 or 4 slides is about the collaboration research, which is still ongoing. And Dr. Yulia actually has already explained about this. The first one is about a smart surveillance strategy for carbapenem-resistant Pseudomonas aeruginosa, or abbreviated as SAMPAN. And the PI is actually Dr. Juliet Severin. So Dr. Julia, I'm only the coordinator for the Indonesia side. Yeah. And this is, of course, a very nice collaboration. We met in person because it was started when the COVID was also begin in 2019, and we just met each other early in this year in Italy, in Rome, and it was very nice meeting. Next slide, please. So the objective of this research is to develop a globally applicable smart surveillance strategy for carbapenem-resistant Pseudomonas aeruginosa, and to gain insight into potentially relevant sources and transmission routes of carbapenem-resistant Pseudomonas aeruginosa in the environment and in humans, and also the development of highly sensitive methods to detect carbapenem-resistant Pseudomonas aeruginosa in humans and specific environmental niches. So this is also have one health aspect for this between human and environmental side. And next is about the other ongoing collaboration research. It's about the study of impact of reducing colistin use on colistin resistance in poultry in Indonesia, or we call it as a coincide. JPI AMR, and for Indonesia side, we get the grant from IDRC Canada. So in this study, it's also the collaboration between Indonesia and then Netherlands, Belgium, and Canada. Yeah. And of course, we also collaborate with the Ministry of Agriculture. And this is the research objective because we know that the colistin is used by the animal health so many, and that and in 2020, the government published the regulation to ban the use of colistin in animal. And that's why this research is to evaluate the resistance before the ban and after the ban. And fortunately that we had such research also in 2014, and we have the collection of E. coli isolate both from human and animal side, so that why we can use it for this monitoring research. So I think this is all what I can inform in this very nice occasion. Thank you very much. Back to Dr. Yan.
So, Dr. Anis, thank you very much for your comprehensive overview, I think, of AMR problem in Indonesia and studies ongoing, and also to build international networks to have research capacity to fight this this very urgent problem. I look at my co-moderator, Juliette. Anything to add from your side after these presentations before we start the Q&A?
Yeah, I think these are great examples of, well, the problem of antimicrobial resistance is, of course, huge worldwide. We're all dealing with it. And for the Indonesian situation, there are specific problems. So in these research projects, the knowledge is actually expanded on the problem, and then you can also think of where to take action. So I think these are real important research projects. What I really liked about the presentations is that the multidisciplinarity was underlined, and also the One Health approach, which was also highlighted by Dr. Anis in the project of Coincide, where there is a strong relation or strong focus on the animal-human interface, and in the Sampan project, where it's the strong focus on the human-environmental interface. So talking about the One Health approach and capacity building, could you comment on that maybe a little bit, Dr. Anis? Because, well, we are in this session with 5 clinical microbiologists and 1 infectious disease specialist. And of course, diagnostics and antimicrobial stewardship are important. But can you maybe mention a little bit about the One Health capacity building?
Yeah, thank you, Dr. Juliette. So There are some small study actually, so it is not really done in all province. But for example, we have done the capacity building using a One Health approach in 2014. It was in Central Java. So we try to give the understanding in the community about the problem of AMR, both in the farmers and also in the other, so the neighborhood of the farmers. And also we try to give the understanding about why antibiotic only can be used after from the prescribing, so not directly by on the counter. And also there is what you call a good example in Bali. So they have a village. They focus so by Professor Sri Budayanti from Udayana, Bali, and in this activities, they give the education in one village. So they make this as a pilot project, and they give the education not only in the community level, for example, to the mothers, but also to the students in the school age. So and I think this model, this kind of model should be what you call it, strengthen, and then maybe we can replicate this village to other area. Yeah, so this is very important for us actually to make a specific module which is of course different depend on the which age is the audience. For example, to the school age, or maybe for the student in the undergraduate, or maybe also to the what you call like farmers, and also other healthcare workers. Like, you know, here we have also like a nurse, but they prescribe, and also the midwife is prescribe also, even though they know that the regulation will not allow this, but they still do it. So how to make them understand, it's very, very important.
Okay, thank you, Dr. Alice. I think it's what you then mean also is raising awareness about the problem and how to try to deal with it. So that's a good summary. Yeah. There is one question in the chat where there's a question from Asmi. Yes, so I think we discussed that just now, that AMR must focus on health sectors. How about the spread of AMR outside of the health sector? So perhaps Dr. Anita, someone else can comment on that shortly, because I think also what Dr. Juliette already said, Indonesia has its specific problems, I think also in the One Health area. So any one of you who would like to comment on this remark? So how much AMR is there outside of the health sector?
Yeah, I try to answer it. So the Ministry of Agriculture did also the surveillance for ESPL producing E. coli. And but so I don't have the slide here, but until now they do it just for broiler, so not for other poultry. So that's why maybe, and I think also not very wide. The sampling is not very wide, so it is still cannot represent the situation of all Indonesia. And in the fishery, they have also done surveillance survey actually still, because it's still once until now, and it's still also from 3 sites. So I think it is also an issue that still we start the first thing. And the second thing is also how, so which microbe is actually the target for surveillance. Now we still use ESBL producing E. coli, but maybe in the animal side, it has the importance as well as we in human side, but not really in the fishery, and also maybe in other animal health. And the other thing is also that our problem now in human side is not only about ESBL producing gram-negative, but also the carbapenem resistant. So maybe we have to think more about this, about the surveillance system, and which parameter should be used for all sectors.
Yeah, I think maybe we should, we have 1 minute left for the last question that's in the chat. How is AMR understanding on grassroots level, as people tend to treat themselves if they feel sick? Who can
So
answer
perhaps
that?
can I start with that, because I just gave a lecture here on antimicrobial resistance and antimicrobial stewardship in Malang, and I was shown an app. Perhaps Dr. David knows what was the name of the app.
The Hello Doc.
Hello Doc. And so the discussion was about over-the-counter drugs, but I mean, for 270 million people in Indonesia, you have a Hello Doc app where you can buy any antibiotic which you can give orally, available on the market. So I cannot agree more, perhaps, with the one who posed this question, that as people tend to treat themselves as they feel sick. I think it's, but I also asked Dr. Julia and Dr. Dewi and Andy and Dr. Anis to comment on that, but it's so easy then also to get antibiotics over the counter that if we try to tackle the problem from the hospital side or the One Health side alone, then you miss out a very important potential problem, I think, as well in Indonesia. So would like to hear your comments on that.
Dr. Anis, sorry. I
Yes,
saw
please.
in the Hello Doc that they sell the antibiotics without prescription. But for phenyl pseudoephedrine, they sell with prescription. That's I said to Dr. Yanawan whether it's maybe we should educate the educate people to not buy the antibiotics without prescription. More strengthening the education for the people. Dr. Anis, please.
Yes, thank you, Dr. Devi. I agree with that. So I think it should be done by both sides. So
We cannot hear you,
because
Dr. Anis. At least I cannot hear. Oh, sorry. My fault. Go ahead. Please go ahead. Sorry.
yeah, so the regulation is actually there that it should be delivered only with the prescription. So now how to make a punishment for those who sell without prescription. Yeah, so and I think this is the what you call the responsibility of the government to monitor and evaluation their own regulation. And the other side is, of course, our responsibility also as a part of the community to give or to educate our neighborhood, and also that's why how, because the understanding about resistant AMR resistant is not that easy for the community. Sometimes they ask me, so if I have sore throat now and I take amoxicillin, what happened with me? So nothing happened, right? And that's why we have to explain that this is not the impact is not directly in you maybe now, but maybe in several years. And this is not only the impact is not only to you but your children and your and the next generation. So this is a very important things that we need to to make a like a module, so or how to make them understand. So this is very important, I think. I don't know, in Netherlands, I heard that there is a comics also, Dr. Juliet, for this to educate the children. So maybe we can also make something like that. And also from through the social media, but we need to design it very well. Yeah, so not too long, but it can so eye catching. So maybe they can. We need something like that. So please, everyone, if you have an idea how to the model, how to educate the community, it's very welcome. Thank you.
Yeah, Dr. Anis, I think you pointed out correctly that we have a comic book. It's a very famous, comic, and it was changed in something with antibiotics. So you should not take antibiotics when you have a viral infection. And that's the message that they want to send out with the comic book. But of course, I think communication strategies need to be adapted to your the group that you want to address. So this works for the Dutch children, but I don't know if it will work for the Indonesian children. So my question to you would be, we're talking in this session about AMR and capacity building and research. Should we have more research with other disciplines maybe to see how what would be the best strategy to address this problem of antibiotic use in the community by internet sellers and pharmacies? Maybe Dr. Julia or Dr. Andy can comment on it as well.
I think I strongly agree with what you say, Julia. I think we really need to do cooperation with the other stakeholders, for example, especially in Indonesia, the veterinary and also the food industry. But still, I don't know if it's the AMR, it's a losing war for us, because it's not only the resistance happen in domestic animal or patient, but we can find also in wild animals. So I don't know who giving who the microbial resistance, but I think we really need to build the One Health program to see where this problem is starting, because it's strange. Even if we say that in Halodoc they sell antibiotic, it's freely, for example, but it's only like amoxicillin, not the like carbapenem. But this carbapenem, even in wild animal, we can find carbapenem resistance. So this is really how to say what. It's really, I don't know, it's quite difficult to think where this thing come from. I think that's what I'm going to say.
Yeah, for me is very necessary, Juliet, to involve the multidiscipline, accepts the from the others, the healthy, from the health care people, because in our experience, when we are give the educations like in the social media or like radio or some social media, when we are give the education about the how to use the antibiotic appropriately and something like that, and yeah, we still have a problems to give the understanding for the others, especially from to the community. And also maybe yeah, the nice research collaborations, I think, from the social discipline, the social science, because I think in Indonesia is thousands cultures, and I think is a very different cultures, and also difference maybe for the we should how we can give the our educated strategic for the all of the people from the stage or for the cultures in Indonesia. I think that's important things.
Yeah, thank you very much. I think it's an interesting topic that you just touched, Dr. Andy, about the carbapenem resistance that you found outside the hospital, outside the farms. So that's the wildlife you said. So that's more related to environmental contamination, probably. So that's really also good to focus on where does it come from, and it's really the circle, and everything is connected to each other. I see another comment. Oh, that's about buying antibiotics in the pharmacy stores, and the pharmacist will give it easy in our beloved country and less explanation about the impact. I think that's a true comment that was already partly addressed, and I think the topic of diagnostics is related to this, and this is also in the the goals that Dr. Anish showed. Diagnostics is important. And when it comes to capacity building and AMR research in diagnostics, do you have enough capacity? And what I think the answer is going to be no, but where should be the focus on when it is about capacity building for diagnostics? Should it be in clinical microbiologists, and how? Or should it be in technicians involved in lab testing?
So the first thing is actually the capacity building of the management of the hospital. Yeah, so because they don't really understand what is actually the microbiology laboratory. They think that the culture of aerobic bacteria is the laboratory services that can be done by microbiology. They don't think about the fastidious bacteria, anaerobic bacteria, viral, and other difficult growth bacteria. So this is the first important thing, I think. You know that every time if the we ask about what is your capacity, if we ask the hospital, what is your capacity? Oh yeah, we have this instrument, and we can do the aerobic culture. That's it. So, but how? So they don't realize that the quality of the specimen, and also the antimicrobial susceptibility test is not that simple. it is difficult to give the understanding. So they just think that doing the micro lab is like hematology laboratory. Yeah, so this is the first thing that we have to give the understanding to the management of the hospital, because also it is also related to the insurance, you know, the BPJS, the national insurance. This is only for one disease and one package for the insurance, and there are different policy in each healthcare facility. Maybe in Sutomo, in Saiful Anwar, and also maybe in Cipto also, the hospital will pay the lab diagnostic for micro, but not in other hospital. So patient can also have to pay by themselves, or actually they just give a small amount of money. So this is the only you can choose. This can be for lab, a micro lab, or for radiology, for example. And maybe it's only for like 500,000 rupiah. How much in euro? So the doctor should choose this. What do you want with this 500,000 rupiah, for radiology or for a micro lab? So this is also the big problem for us. Yeah. So, and then after that, of course, we talk about the clinician. So not all of them send the specimen of their patient to micro, because for them it's much easier to directly give the antibiotic.
Okay, so thank you, Dr. Anis. Because we're running out of time, I have to mute you. Sorry, because I think what we have been discussing this session is that AMR is a global problem. That AMR in Indonesia is a problem. That we need capacity on all levels: healthcare sector, One Health, social sciences, to try to combat this problem. There are many issues at hand to try to solve. But I think you also, all four at least, showed that through international collaborations, not only with the Netherlands and Indonesia, but also with other countries and other institutes, that you can together learn a lot and try to solve or at least improve the problem of antimicrobial resistance in Indonesia. So that being said, I would like to thank you all very, very, very much for this session. And I hope to see you all very soon again. And to the audience and the viewers, thank you for joining us. And I hope it was a good session for you and you learned a lot. And if you have any questions, then you can approach us for any questions you might have. So thank you very much.